We're in this golden age that we're just at the start of. There's never been a better time, I don't believe, to be a CIO in healthcare and potentially any sector.
Digital acceleration is here. Health systems are walking the path, but are they in the right direction? Welcome to Patient Journey Pioneers, roadmaps from the top digital leaders in healthcare, who share insights and strategies that are pushing the patient journey to new heights. This podcast is brought to you by Hyro, and I'm your host, Liat Kozuch. Welcome, everyone. Welcome back to another episode of Patient Journey Pioneers. Today will be pioneered by nonetheless Reid Stephan, who we all know on LinkedIn. I follow him, true thought leader in the space. He is also VP and Chief Information Officer at St. Luke's Health System. By now, Reid, you've become a friend. You were on our webinar all around responsible AI. You will be speaking at our virtual summit, Digital Front Door Day, September 25th. I can't seem to get enough of you. Great friend. And now we have him on the podcast. Thank God I found some time in the schedule. So humbled to have you, Reid, and let us know where you're joining us from.
Yeah, Elliot, good to see you. And I agree, the friendships that we create are such an important part of our career path. So joining you today from Boise, Idaho on a hot, kind of muggy, smoky day in early August.
And Smokey, you were talking about some wildfires there?
Yeah, wildfires mainly in Oregon, and it just kind of has been lingering for a few weeks and just is kind of socked in the valley. And so air quality is not amazing at the moment, but we're hoping for better days ahead.
Okay, hoping for that. Reid, let's start with your incredible journey into healthcare and digital health. I know you have quite a history behind how you got to where you are today. So take us back to what inspired you to pursue this field.
Yeah, I have to give credit to my daughter, Emma. So she was 5 years old at the time in kindergarten, and she's our youngest. And so those that have multiple children realize the youngest kind of grow up faster because they see their siblings and they want to do what they see their siblings doing. And Emma, her fascination with her brothers was always school. So she was just fascinated with them going to school, coming home, having homework. And she was just thrilled to go to kindergarten and to be able to live out her dream of having homework. And so, first week of school, she gets her first assignment. And the assignment is find out what your parents do for work, for their profession, and come back tomorrow. We're going to do show and tell, and you're going to tell the class what your parents do. So, we're at the dinner table, and she's like, Dad, it's happened. I have my first official school homework. And I'm like, what is it? She's like, I need to go back and tell the class what you do for work. So what is it you do? So at the time I was at HP, great company, and I was doing cybersecurity. That was the first half of my career. And so as I sat at the table and tried to think, how do I explain cybersecurity in a way that a 5-year-old and her class of 5-year-olds can understand? And so I said something like, well, I work with a team and we try and keep people from breaking into our computers. And she's like, well, why do you do that? And I said, well, we don't want them to steal information that they shouldn't have access to. Well, Dad, why is that important? Like she did this 5 whys. It was more like 50 whys. And, at the end of the conversation, I looked at her sweet little face and I just had this epiphany that she was going to go to school tomorrow and she could tell her classmates what I did in her own language, but she didn't have any strong sense of why I did what I did. And I think even more impactful for me was I didn't realize, I don't think I could at that time really articulate why I did what I did. And this is not a criticism of HP, great company, great colleagues. But I realized in that moment that at the end of the day, the things we did were all about returning shareholder value. So each quarter we'd have earnings. And what are the things we're going to do to have a good earnings report? So the stock price increases and shareholders get more value. That was the overriding thematic focus of the company. So I talked to my wife that night and said, I love what I do. I love who I do it with. I'm not in love with why I do it. And so I think I need to look elsewhere. So that started a journey of investigation that led me to an opening that St. Luke's had. I started initially in cyber, was a CISO for a few years, and then this role now for about 6 years. And it more than satisfied kind of that desire that grew from that conversation with my daughter several years ago. In that I love what I do. I love who I do it with, but even more importantly, I love why I do it. The mission of healthcare is just so compelling and gripping. And I'll just kind of put a bow on this story. A nice moment for me as a father was many years later. My dad was in the hospital. He was in end of life care. And Emma and I went to go see him after school one day. And we were sitting in the room and she was watching just all the activity. I think it was a shift change. And so nurses were coming in and they were doing handoff and they were looking at all the equipment and doing all the things they do to take care of patient. And Emma, when they left, she said, "Man, they do a lot of things here to take care of grandpa." And I said, "They do." And then I said, "Emma, you see all these devices on the wall, on the bed?" I said, I'm not smart enough to know how they all work, but the team that I work with, like they all do. And that's why we do it, so that these care moments can be as effective as possible. And so it was fun then to have her realize in the moment kind of the why of what I do. So kind of a long answer, but it's super important to me. And so that really, to this day, that's what inspires me and motivates me each day.
Wow, I have so much to say about that. First of all, I think it was the first time a parent enjoys a kid who just keeps asking why, right? That
Right.
you got something out of that rather than just pulling your hair out. And I remember when I did this show and tell at school, my dad showed me his business card and it said president. And of course, he was the president of his company, but I come to school saying my dad is president.
Yes.
That doesn't beat your story,
Uh,
but a cute little anecdote
it's pretty
about,
good.
yeah. So I love that. I love that you kind of maneuvered into wanting to get a bit more meaningful gas in the car to keep you going. Cause I'm sure if you would have stayed at HP, you would have done an amazing job, just like you're doing in healthcare, but you needed that underlying meaning and giving back as the person that you are as well and bringing it into your professional life. So kudos on making that change. I think a lot of people walk around wanting to make that change, but they don't actually make the jump. So kudos on jumping into those waters. I think you mentioned a bit about this, but what makes being a CIO in healthcare so meaningful to you, especially nowadays?
It's about people. It's about people and it's about decisions that we make each day that ideally are in the best interest of people. And sometimes that means that we'll make decisions as a system that don't make sense from a bottom line financial standpoint, but as a community owned health system who the assets of our system are owned by the community. And our mission is to invest those assets to improve the health of people in the community. There are times when we will make investments that, would not make sense in an MBA course at Harvard, but make complete sense and are the right decision based on that mission to care for people. So when I think about my role as a CIO, I love technology. I try and maintain a level of proficiency and acumen in that space. But I've recognized that the things that keep me up at night shouldn't be, are we going to have a cyber attack? I have Shauna, an incredible CISO. She worries about that. It shouldn't be, is our network going to run effectively and is Epic going to log in quickly the next morning when that nurse or provider taps their badge? I don't spend time worrying about that. I have an incredible associate CIO, Jared, who does that. So if I worried about those things, I'm not adding any value. I'm probably distracting or maybe even inserting myself in ways that are not helpful to those experts. So what does keep me up, if you will, or wake me up in the morning as my first thought is, are the people on our team, these 550 incredible colleagues in our IT department, do they have the tools they need? Do they have the training they need? Do they feel supported in the work they're doing? Do they have clarity of what they should be doing and why, and understand how it is moving the measures on the goals and objectives we've set as a system? Do they feel safe? Do they feel celebrated when they have an accomplishment? Do they know where to go when they have a question? So those are the things that really occupy a lot of my thought space and then generates action as a result of that to check in, to help provide whatever guidance or support that I might be able to in my role. And it's a transition I think you have to make as a CIO, and it's relative. Every organization's different. But gone are the days that I'm a hands on the keyboard SME adding value to the system in the way that I've done in years past. I'm very much in the people business, I would say.
I recently hosted Chris Ross of Mayo Clinic CIO, and he mentioned it being almost like an orchestra where you got one person with the trombone, don't get involved in what he's doing. He's got his notes on, right? And one on the flute, and you're basically orchestrating this entire body of people helping to push forward. In my opinion, you would probably have said your father is always in your mind as guiding you when you're making decisions, especially when it comes to digital innovation, which is kind of a bad example because the older population, they are getting tech savvy, but we have to
Mhm.
also take into consideration their tech habits and adoption. I would think it would be your father's, but you were actually raised something very interesting, which is it's your team, the internal team of 500 something people. You need to basically be their backbone, providing them with the tools they need to do their job right.
Yeah, and I love that analogy of the orchestra, and it resonates. And I've thought about this, like a phrase you'll hear or you'll see posted is rock star CIO. And I understand the intent behind that, but that title to me is a little incongruent because if you think about a rock star, typically like solo, like out on front, like on stage, like everyone watching and cheering for them. And that's not what a CIO should be. A CIO should very much be a maestro. So they have this orchestra with diverse talents and abilities and instruments and sounds they make. And your job is to keep everyone on the same time, on the same page, so you can produce this beautiful work. And so that idea really resonates with me. It really is this orchestra that you're trying to conduct and make sure that you can get the very best out of every member of that orchestra.
So is that true that you really are when you're making your daily decisions, whether it's which vendor to bring on, which vendor to let go of, which digital innovation project to embark on, what to say yes to, what to say no to? You have your team as top of mind as a CIO.
Yeah, one of the key foundational elements of a highly reliable organization is deference to expertise. And so I really view these colleagues that I have the privilege to work with, like they're experts in their particular domain, field, function, and I need to defer to that. And so to your point, as you're making those decisions, the idea that there's a leader who then has this omniscient knowledge of everything, it's just not realistic. And so you have to cultivate and mine that expertise across your organization to then help guide and shape. Because ultimately, there may be times when you have to weigh in and be that deciding vote or the decision maker, but you're not doing it on your own. You're doing it to the best of your ability, really incorporating the eyes, the ears, the knowledge then of your incredible team.
Well, that does make you a rock star, in my opinion, if I may, because a leader needs to know how to lead and how to make these decisions and for who. So kudos to you. Let's dive in around decisions, decisions, decisions. Of course, every decade or even every year, there's like a buzzword. There's something you should be considering as a CIO, especially in healthcare and tools and rapidly advancing ecosystem, all that good stuff. So where are we now with decisions when it comes to digital innovation? This is a podcast for digital leaders in healthcare, roadmaps and proven strategies. Where is St. Luke's at the moment? What do you feel pressured about? What have you succeeded recently that you're proud of? Talk to us a bit about that.
I'm proud about our pragmatic approach. I'm proud about trying to avoid the shiny object syndrome. And there is this signal to noise ratio reality that you have to talk about out loud and acknowledge. And it's not necessarily a bad thing, but you just have to know that it's there. And so for us, then, what that means is if we're just reacting to everything that we hear or see at a conference, everything that I might hear about from a colleague, you're going to have kind of this whiplash effect where you're pivoting and recentering so frequently that you're exhausting your capacity and likely not making meaningful progress on any one initiative. So we've tried to take a step back and really be intentional about defining our objectives. And then with those objectives, then defining what's the strategy that we want to employ to accomplish those objectives. Now, that sounds simple, but here's what I would offer. I've got a bachelor's, I have an MBA, and I would say that nowhere along the way in my education was I effectively taught how to think about strategy. We talked about it all the time, but there was not this pragmatic skill. And maybe I was a bad student. Like maybe my classmates got it and I missed that day.
I have to doubt that.
But I find that a lot of times we will historically have called things a strategy that's not a strategy. So, for example, we may say our strategy is we want to improve provider well-being. That's not a strategy. That's a very noble and important objective, but it's not a strategy. The strategy
That's
would be,
almost like the
okay,
end goal, I'd say,
yeah,
or the
that's what you're
result.
trying to get. That's the destination. The strategy is what are the things we're going to do to get to that destination? So to more precisely answer your question, with that objective then, and that's one of our key objectives, is how do we improve provider well-being? How do we address the very real experience of burnout that we hear loud and clear from our physicians, our APPs, clinicians that are out there? And so with that in mind, and working with our executive medical director over provider well-being, defining then, here's the measure today, here's the measure we want to get to, how are we going to do it? It really
Pause.
let us.
Sorry, pause.
Yeah.
When you say measure, can you explain?
Yeah, so measure really based on provider satisfaction scores. So the percentage of providers who say, I come to work each day feeling burned out, feeling like it doesn't matter what I do, I just can't make a difference because I just have all these things. I have my panel size, I have this never ending portfolio of technology that I'm asked to navigate and use in the care and treatment of my patients. And it just feels like it's insurmountable. And so that score, not where we want it to be. And so then Dr. Snyder saying, okay, let's improve that by 5 percentage points. What can we do to move the needle on that? So that's a great objective and it's measurable. And so then you can use that lens to then narrow in on, well, what are viable strategies that we think can really do this? And one that clearly emerged, and this is nothing unique that I'm going to share, the listeners are going to be like, oh, we never knew that was a possibility. But the ambient listening capability that's really matured in the last 2 years with the advent of generative AI, that was a very clear capability that we knew we wanted to pursue as a strategy to address that objective. And we're almost done with our pilot, and we have had phenomenal results with that, as many other organizations have had as well. I have never seen a provider community more excited about anything, let alone technology. But to have a technology that we deliver that not only meets kind of what they had hoped it would going in, but exceeds it. But then also on the flip side, patients also expressing, I don't quite know what this is, but I love that when I come in for my visit, Dr. Rutherford just looks directly at me and talks to me and does not break his attention from me. He's not trying to do this swivel where he's talking and then typing and then talking and typing. And so that's been a very exciting and rewarding journey that I think knits together nicely the idea of be clear about your objective, where you are, where you're trying to go, and then use that to really hone and shape the strategies that you want to employ to accomplish that.
That's amazing. And I'm sure there's so many objectives that come to mind, but just to see what's involved in implementing this into your organization and that change management that's called for to actually make it happen. It's so easy to just recommend a CIO do this, do that, but to actually make it happen, you really have to pick and choose. Question, if you feel comfortable, you can do a shout out to whichever technology or vendor you trust that has shown success and brought value to your organization just for other CIOs to learn about if you'd like to.
No, happy to. And I think this is an important part of these kind of conversations. So this is meant to create community awareness and knowledge. And this is not advocating that this is who you should use, but this is our experience. So we have used a vendor, a company called Ambience. So ambient, but CE at the end, Ambience. And they have been great for us. And there's a variety of vendors in this space who are doing really wonderful things and people are having great results with. And every system is different. And it said, if you've seen one, you've seen one. And so you have to figure out what vendor, what partner really, because that's what we want is a partner, not a vendor, is going to align with the objectives that you've defined, the strategies as you envision them. And then with this in particular, and if I can just take a minute, I think initially this was very much about AI scribing. That was the primary use case that we approached our pilot with. And it's, like I said, it's been very successful. But I think we're getting to a point, if we're not there already, the pure AI scribing play, it's going to become a commodity. It's going to become something that's just built into tools. It's going to be expected by our provider community. I think in time, it's going to be expected by patients who want that kind of experience when they are in the clinic room with their provider. So then the question is, well, I want a partner then who has kind of a shared vision of a platform, a solution that can solve not just the AI scribing piece, but a variety of other use cases that lend themselves really well to ambient listening type functionality. So that was our mindset. And that's why we ultimately have selected Ambience and it's worked well for our needs.
Very cool. Not sponsored at all, by the way, for the listeners. You won't be hearing now like a minute ad. None of that. We just want to provide knowledge for our listeners. So that's just one of some vendors that worked for you. And Reid, when you are implementing these partners, vendors, technology solutions, what are some red tape that you have to go through? What are some challenges that you have embarked on that you could already share with our listeners, and how you tackled those? And this is something you'll be talking about on the summit as well, Tales from the Trenches, which I can't wait to be part of that because it's going to be a very vulnerable and real and raw and kind of down to earth conversation about which pitfalls to avoid as a CIO, But tell us a bit about like your strategy on overcoming all that red tape in healthcare.
Yeah, and it can be exhausting at times, especially when you have a really clear idea of how a solution or capability might meet a really pressing current needs you have. So I think the first thing I would say is just patience and appreciation for all of the different players within your system that add value to the entire process, even in ways you may not fully understand. And as much as you can kind of pre-wire those things up ahead of time, the better. And what I mean by that is, so if we find a partner or vendor that we believe we're going to work with, we've got a pretty good playbook of things that we know that they're going to have to navigate through from a cybersecurity perspective, from a compliance perspective, privacy, legal. And so we try and pre-wire as much of that as possible and give vendors, partners ahead of time a view of that so they can look through and see if there's anything there that's going to be a showstopper for them. And in particular, in this day and age, with the emergence of AI capabilities, and there's new companies and startups, like some of them aren't going to have some of those mature kind of back office shared services processes dialed in, like you might with a more mature vendor. And so to be able to find out early on, is that a gap that you can bridge? Is that going to be a deal breaker? So we've had good success with having even pre-meetings. So we bring in an SME from cyber, from privacy, from compliance, from legal, just to talk through at a high level where we think we might have some bumps in the road that we're going to have to navigate either over or around. And that helped us early on identify potential partners that we've recognized it's just going to be a bridge too far. Like based on historical knowledge, we know that we're not going to get the okay for this particular risk element, or it gives enough time for that vendor or partner to put things in place so that when we get to the point of contract execution or actual launch of a pilot or a project, we're not then trying to do all that at the very start and then your whole project schedule is blowing up out of the gate. So as much proactive planning and conversations and activity that you can do ahead of time, it serves our purposes very well.
I love that. I really respect that proactive approach because it's taking into consideration the fact that no one has any time to waste. And it's almost like a win-win for both sides. You're helping this vendor slash potential future partner know what to expect and to even avoid a call that's not needed. And not to toot our own horn, but for example, Hyro is healthcare specific. So once you know that about a partner, you know that they've been through that, not their first rodeo in healthcare with compliance, with privacy, with all the safeguards in place to feel comfortable even hearing a bit more about any vendor. So very good. I love that approach. I think that other people should learn from that. It's a very efficient way of managing time and projects. What if you had like a magic wand as a CIO in healthcare? What is one type of technology that you wish had existed today, or even just a compilation of technologies? I know you mentioned a one platform, one size fits all. I hear that from a lot of our CIOs to avoid the silos and all that. But with your magic wand, what would you ask for?
I'm going to give you two answers. One is, maybe a little tongue in cheek, but I think what would be cool is a unifying interface. So no matter what virtual meeting technology you're using, whether it's Zoom or Teams or WebEx or go on down the list, there's this interface that would translate it. And so whatever your core virtual meeting technology is, you'd be able to navigate whatever the solution is you're actually using at the time. I just think of how much time would be saved and how many calls I'm on where we invite somebody and they've not used Teams before. They're not just adept with it, and the time we spend trying to create some basic proficiency or vice versa. So I think that would be awesome. And if I was smart enough, I would figure out how to make something like that. I think that'd be really cool. Now, on a more of a healthcare application specific area, I think that there's capabilities that are here and kind of coming online. But if you think about our EHR, we're an Epic shop. We are so data rich, but like information and insight poor because the nurse, the physician, the APP, whoever it is, in that moment that they're in the EHR, and this is not the knock on Epic, it's just complex. It's a complex system. It has so much data there. I was talking to my sister-in-law who's a nurse, and she said, yeah, like Epic's great, but I'm in there and I'm in the room with the patient and I need to look up something, but I don't quite know how to get to the screen where I need to go to look it up. And so I just have to not do it. And so I just do my best in that moment because my time is so constrained. If there was a way to more accurately and quickly anticipate what that caregiver might need in the moment based on all the data that the tool or AI could have access to make it more accessible and more intuitive for that person for how they could actually find it or surface it, I think that would be an incredible game changer in terms of the quality of care, the outcomes that we all are aspiring for, and reducing the overall cost of that care. And I know there's capabilities out there that do some of these things, but I'm talking like even more holistically and universally, a real workhorse engine that would just drive that and learn and improve as it goes. That would be awesome.
Okay. I placed your wish in the genie's, what do you say, genie's bottle. Before we reach our fun speed round, which is the favorite part of my episodes, one more question about St. Luke's is really what's next? What's on the roadmap? Whatever you feel comfortable
Mhm.
sharing. Next digital innovation project that's getting you excited.
Yeah. So we are about to break ground next month on a pretty major expansion in our main flagship downtown campus hospital. And it's going to be over several years, but massive in scope and also really fun because we are taking this opportunity to really bring our toolbox of how we approach innovation, which is empathy, curiosity, rapid experimentation. Those are kind of the three elements that we anchor to. And so we're thinking about, as we have this kind of blank canvas, building this new hospital and expanding one that's already there, how do we think about experience differently? And so let's just, for this conversation, kind of hone in on the patient room. And so some of the things we're thinking about are maybe not technology innovative, but like just from a usefulness and a satisfaction perspective. So how do we design the hospital so as much as possible, the rooms are the same shape and size, that we can put equipment in rooms in the same spot? Because that's not the case today. Rooms are different sizes. They might be used for the same purpose, but you go in a room and in this room, the gloves are on the wall on the right. The next room for the same type of patient treatment, well, the gloves are on the wall on the left. And those things just add up. They have this cognitive drain on our clinicians. And it also puts them in a spot where I think at times they might feel embarrassed or feel like they're not showing in the best light as they go in to take care of that patient. And then on the technology front, we've aligned on, okay, every room, we need these four things. We need Wi-Fi. We need real-time location services. And so that's a project we're kicking off this year that we're excited about to get that foundational component in place. We need the ambient listening capability, AI fueled, and we need computer vision, also kind of AI filled. And so that really excites us as we think about how we can bring together known capabilities, emerging ones, and really create this exceptional experience in every room in the hospital, whether you're the patient, whether you're on the care team, EVS, FNS, family member, whoever it might be. We want everyone that walks in that room to have an exceptional experience in whatever role that they're playing in that room.
Now I understand why healthcare was so attractive to you because really with every change that you make, every decision you make, say yes or no to, it has this ripple effect of well-being for all, not
Yeah.
just your clinicians, not just your physicians, not just the I team. It's the patients, it's the caretakers on the other side. It has this nice ripple effect of great karma as well. So I totally see that. And now following your strategy on how to create the right strategy, what would you say your objective is? And in maybe 2 to 3 words with this new project? And what is your strategy to get there in 2 to 3 words?
Experience exceeding expectations. And I like the alliteration too. That was unintentional. But yeah, that's the objective. How we measure that, we're working on. And so then the strategies would be then, what are the capabilities that are no regret, non negotiable? And I kind of rattled off the four that we feel are kind of the foundational cornerstones. And then what are those things that we trying to see in round corners or skate where the puck's going to be? What are those emerging or future things that we can maybe slightly imagine, but not fully bring into focus that we need to design for and future proof those rooms, that facility as much as possible so that we can be as agile and responsive as we can to future capabilities that start to come online.
Well, amen to that succeeding. I'm gonna have to have you back in 2 years. How long would you say that takes?
I think that'd be good. Like, I think we'll be kind of into our first phase by then. It can share what's worked and what hasn't.
Awesome. We are now moving on, my dear, to our speed round, the funnest part of today. I'm going to start with a little game that I haven't shared with you before because I really want your genuine answers. It's called
All right.
bullish or bearish. And you are going to tell me what you think about each of these trends that I'm going to bring to the table. You're going to tell me if you're bullish or bearish. You ready?
Okay, I'm ready.
All right. Number one, telehealth.
Bullish.
Why?
When we talk about it today, a lot of times it's a virtual primary care visits in large part. And I know there's other things that folks are doing, but it's still so untapped. And when I think telehealth, it's a broad umbrella for me. So yeah, it's the virtual video visit. That's important. It's remote patient monitoring. That's important. There's people today at St. Luke's that are in a room that would actually be better served to be home to let us monitor them there. I think the science shows that provided there's not some serious illness that needs that kind of hospital-based care, people are happier and they heal better in their own homes. I think adjacent to that is hospital at home. And we have a project that's just kicking off that goes online early next year to roll out our first hospital at home program. And we're estimating that we have a capacity issue. Like most days, we're close to census, 100% census in many of our medical centers. And our VPs of those medical centers say, if we had a hospital at home program, I could free up 10 beds today. And that's huge. And so
Wow.
that's why I'm bullish, is because there's so much untapped potential that creates this rising tide that really, again, those are the things that I like is the experience solutions that benefit everybody. Because sometimes it can feel like a zero sum game. It's like, well, it's great for the provider experience, but the patient has to sacrifice something. Or it's awesome for the patient experience, but now we're tasking the provider with doing one more thing. So finding those capabilities that create that uplift, that synergy of experience for all involved, that's really beautiful and gratifying.
Which is why you're making me view the CIO role as more and more of a conductor of the orchestra because you have to
Hmm.
find that harmony, not to go too much onto this
Yeah.
like metaphor rabbit hole, but like to get everyone on the same note, you have to make sure that both sides are balanced. Patient isn't sacrificing, provider isn't because some stuff we could bring into the health system for the patient,
Yep.
but that's just like the providers will want to kill you for that. Like it just
Yeah.
will make their lives harder. So it's finding that balance. Okay. My next one, because you stole my second one, remote patient monitoring, which I assume you're bullish on
I am.
for all obvious reasons. My next one is wearables.
Bullish with the lowercase only because I don't have a negative outlook. I just think it's farther down the road than people maybe anticipate or hope for. So it's like when I think about our wearable approach, it's, with MyChart, you can connect your Apple Watch to MyChart. Like that's the extent of how we're using wearables. And so I just haven't quite experienced or seen that really compelling app or use case or solution that's really going to drive this. It still feels more like there's some niche use cases that we're seeing kind of across the system. People that use wearables in their life today, like I said, they want to integrate it with MyChart, but it's not really driving improved care or outcomes the way that I think that it will. So I think the other things we talked about, they're more on the near term horizon in terms of how I think we're going to really harness great value and benefit. To me, wearables is a little bit farther out.
Got it. Okay. And lastly, in the mind of a CIO, we were talking about hospital at home, and it seemed like your eyes really lit up when you were talking about that. And I kind of wanted to be like, yeah, well, if only we
Yeah.
had more hours in the day, because that's what I'm kind of sensing from you. But is that true? Like, is it really if we only had more hours in a day type of thing? Or what causes a CIO to kind of put that on the side, on the back burner, and focus on, for example, the ambient? Like, how does that thought process work? Is it just a 1 day type of thing? Are you starting to think about it?
Yeah, that's a really great question that kind of gets back to the signal to noise ratio dilemma that we all face. There's just some really compelling, incredible solutions, but then also like areas of exploration, like a hospital at home, for example. But then how do you rank order that against, all of the other opportunities that are out there? And so that is one of the emerging capabilities that we're trying to really mature with as a system. We have a longstanding tradition of saying yes to almost everything because, especially in healthcare, these ideas come in and they're all really good ideas. Like, I'd be hard pressed to share with you an idea that came forward that I was just like, oh, no, that makes no sense. We would never do that. Like, every idea feels like there's some merit there. And the people like sharing the idea, they're so passionate about, because again, at the end of it, there's a human involved and that's what's driving it. And so that's so compelling. And so it takes great discipline then to have the confidence to say, that's a good idea, but compared to this great idea, we're going to table that good idea for now. And so that's the art and science of not just a CIO, but I think healthcare leaders is how do you figure out that calculus for your organization of where you draw that line of great versus good. And we don't have unlimited capacity. So we have to laser focus on the great things, but then also like, are there great things that can increase capacity so we can maybe do some good things? So that's another way we're kind of looking at some of our opportunities is, are there areas where we can drive productivity to then expand our capacity to be able to do a little bit more, but in a digestible, realistic way, not more in the standpoint of like, well, let's just work some extra hours this quarter because that quarter turns into 2 quarters and then it becomes unsustainable. So that is a dilemma we always wrestle with, but also a really fun one to try and figure out how do we tune those dials to be as aligned as possible in knowing that what we're doing is driving the most value for our community.
And I believe this is a lesson CIOs tuning in should learn from you, really. And I don't mean to, keep flooding you with my compliments. I truly see it from our conversation. Your leadership style is very personable, very friendly, sees the individual as a human being. But when it comes to your analytical side of your brain, you're very conservative when it comes to what you promise, and what you promise will come forth as a project, and how you measure that project in a very realistic way, and not just to, put a bunch of objectives and just have it sound good and sound successful. I think you put all your guidelines in place with a lot of thought behind it. And that's something that I think a lot of leaders, I guess, don't really focus in on as much in their day to day, especially when things are hectic and there's low capacity. So that's just the lesson I'm learning from you as far as leadership in general, not only as a CIO in healthcare, just to be realistic and have that strategy planned out all the way to like the number of, I don't know, whatever you have in the rooms that you're planning in your new facility is just like down to the T. So great job on that. Okay, next speed round part is in one word. How would you describe the role of the CIO today? I think we discussed conductor of an orchestra. Any other word you'd use?
Yeah, amplifier comes to mind. Again, kind of the same. You're not the one playing the instrument, but you want to try and amplify and really increase, not necessarily the volume, but just the tonal quality, if you will, of those you have the privilege to work with.
Awesome. And in one word, how would you describe the future of digital health?
Golden.
Wow, that's optimistic.
Yeah, I feel like we're in this golden age that we're just at the start of, and there's never been a better time, I don't believe, to be a CIO in healthcare and potentially any sector. There's just going to be so many opportunities, and the value of the role we have is, I think, understood. One of the things that I would just say, sometimes there's a worry about like who you report to or like what table you sit at or the leadership bodies that you're a part of in your system. And every system's different, but I find that those are our secondary questions. And the primary questions are more, how's my team doing? Are we clear on our strategy? Do we have the resource capacity to execute our strategy? Like those are the things I can control. And if I focus on those primary questions, the secondary questions usually take care of themselves and also don't seem as important as maybe they had before as well. So it's fun to be the CIO right now, and there's so much opportunity to really drive value for people.
It's really ironic that you say that. And I'm just going to take a few more minutes of your time. It's funny you mentioned that it's the golden age for the CIO, because tell us a bit just in a few words about the summit. You're going to be joining us on Digital Front Door Day, September 25th, and you're leading your own panel alongside Chuck and Heather about like kind of tales from the trenches. So there are trenches involved,
Yes.
despite this golden age. And so tell us just a bit about what you'll be speaking about for those who want to join.
Yeah, and that's a perfect tee up because at my core, I'm pragmatic. And so, yes, it's a golden age, but not like, hey, everything's wonderful, everything just works, life is a dream. No, like it's hard. And
I
there's
think you
golden
have a job
opportunities.
today because
Yeah.
nothing works just as
Yes.
is.
So in the trenches, and we'll talk about this, is that there's a technology component, but like you think about a digital front door, if you don't have your provider templates dialed in, if you don't have alignment across your provider community and your clinics around centralized scheduling, for example, or the visit types, online scheduling, none of the other stuff is going to matter. So here's the golden opportunities that are there, but here's also like the ground level reality that you have to solve for. And we'll all share, here's times when we didn't solve for that and still tried to push ahead and it didn't go well. And here's times when we figured out how to kind of solve it. Here's how we did it. And here's how much better than the experience was. So the intent is it'll be very open and candid and transparent, not at all like, we've summited the mountain and it's so great up here. Come join us. We're all still climbing and we're just trying to provide some anchors that you can attach your rope to help you in your journey to maybe go a little more quickly and a little more safely.
I can't wait. I actually fought to be your moderator for that session because we're switching off at Hyro. Who moderates which session? Not like in the conversation, but just managing the chat and introducing you guys. So I'm like,
Yes.
no, I'm taking Reid's because Reid's my friend and he is an awesome dude and it's going to be an awesome session. So
That'll be
speaking
fun.
of awesome dude, not a lot of people know you beyond obviously the CIO that you are. I've learned to really meet this awesome guy, down to earth. Let's talk about music for a sec. I'm a music lover, so I have to put this in. Big Pink Floyd fan. May I ask what your favorite band is? And if you could choose any city to watch them live, where would it be? Thank you. I really like that question. I made it up myself.
It's a great question. My wife is a huge Pink Floyd fan. We have very different musical tastes. She has a much broader kind of range and array of musical interest, and she'd be a much better respondent to this question. So let me tell you this. I enjoy classical music. And so what I would say is, and I really enjoy piano. So it's not a band necessarily, but a pianist. Her name is Yuhu Wang, and Rachmaninoff is one of my favorite composers. And so thinking about your question, it would be amazing for me to be at like Royal Albert Hall in London at near front row watching Yuhu Wang play Rachmaninoff's second composition. Like that would be a bucket list item for me. It's not Pink Floyd, but it still fills my bucket.
Love it. Mine would be Pink Floyd in Amsterdam, no doubt, with your wife,
Love it.
with some
Yeah,
wine. Lots of fun. That's awesome. So we have reached, Reid, the end of our amazing episode. I'm going to finish us off with more of a philosophical question here. This podcast is called Patient Journey Pioneers. What does being a patient journey pioneer mean to you?
I love that question. So maybe let's start with just the definition of what a pioneer is like in this context. So for me, it's relative. A pioneer is someone who is opening up a new method or a new pathway. Now, this doesn't mean that it's a method or a pathway that no one else has ever done before. And in fact, in my experience, I don't think it ever has. It's always been a path that somebody else has created and I've learned from. Maybe I've made a few modifications, but I've drafted on it. So I would say a patient journey pioneer is anyone really, who makes the path and the experience better for patients, whatever that looks like, process, tool, a new way of thinking, and anybody can be a patient journey pioneer. It doesn't matter what your role is.
I love that. Well, I want to thank you really for being a true patient journey pioneer. That's how I view you, both professionally, personally, everything all around. You are a true patient journey pioneer, in my opinion. So thank you for everything that you give back to the community with your wisdom, your knowledge. We're excited to have you speak at our virtual summit, September 25th. It will be recorded for those who are like, dang, I can't watch Reid live, but I will watch it recorded afterwards. So don't you worry. And thank you, Reid, again for everything. I could have gone on and on with questions because you're such an interesting person, but I will let you go on your busy day.
Leah, thank you. Appreciate the friendship and all you do for our community.
Thank you for listening to Patient Journey Pioneers, brought to you by Hyro. Subscribe to our podcast on your favorite listening platform. See you on our next episode.